Coming up on Sunday's Politics Scotland, the Health Secretary tells this programme regular testing of all health workers for coronavirus still isn't happening, and she can't say when it will start.
Is not happening consistently in a planned way across the country, which is precisely why I issued that letter of instruction to every health board chief executive.
Hello and welcome to the programme. New figures suggest that up to 900 patients may have contracted coronavirus in Scottish hospitals after going in for some other condition. We have to say may because they are still not routinely testing all hospital admissions, so it's unclear whether some of these people already had the virus on entering. This follows the grim announcement this week that deaths from coronavirus in Scottish care homes have now overtaken those in our hospitals. Yet it seems that many care home workers still haven't been tested and could potentially be working between homes with confirmed outbreaks and those that are COVID-free. A little earlier, I spoke to the Health Secretary, Jean Freeman. Well, first of all, what is the situation now in hospitals? Are all staff in hospitals now being tested regularly?
No, not yet, Gordon. That's part of the work that is underway as we slowly and safely begin to restart parts of the NHS. We're looking at the possibility of testing staff perhaps in certain areas of the hospital. Cancer UK, for example, has asked for what they describe as the creation of a safe space. So that would be for the increase in cancer work that is part of remobilising the NHS, that we would look at testing there for both staff and possibly patients.
It seems extraordinary that we haven't got in place a system of testing. I mean, good heavens, the World Health Organization, test, 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 that's their mantra. It seems extraordinary that we're in June and we still don't have a system of regularly testing. And we know from new data that's been revealed that 900 people who've gone to hospital without coronavirus have then contracted the disease. And yet we still don't have a proper testing system in place.
So a couple of things to say about that, Gordon. First of all, the 900 people you refer to, what we don't yet know, the work is underway, is whether or not those, all of those or some of them contracted the virus when they were in hospital.
Yes, that's because you weren't testing them on entry, so you can't tell.
Or whether they had the virus and it was in the incubation period. That work is underway, and I'd hope that by the end of June we will have validated data on that, which of course is important. We are now testing all 70 years old admissions, 70 and over. We've been doing that for some time. And actually what the World Health Organization said was that as you build up your testing capacity, the right way of using that is on those who are symptomatic and then move towards those who are asymptomatic.
Yes,
so
but
we've started that in care homes, and we are now looking at that for hospitals.
There were voices back in March when testing was stopped, voices from inside hospitals saying that all medical staff should be tested regularly, and it could have been done, and it hasn't been done. I mean, can you tell us when all NHS staff will be tested at least weekly?
I can't give you that timescale right now, Gordon, because our boards are busy working up how they are going to restart and discussing that with the clinical teams involved, including the staff. What we do know is that where we are reintroducing more elective work, then there is discussion underway with the clinical teams about testing patients immediately before surgery, and alongside that, testing the staff who would be involved in their treatment.
This problem
now, you do need to involve the staff in these discussions because you are testing asymptomatic people. So you need to make sure that everyone is involved, everyone is content with that before you can introduce it, and that you've got the evidence to support it. Now, I'm not disputing the point about the evidence. What I am saying is that you need to engage people in order to be sure that they are convinced as clinicians that this is the right thing to do.
Do you know if this problem of people coming into hospital without coronavirus and either bringing it in or contracting it while they're there, is it concentrated in certain hospitals?
Not to my knowledge, it's not.
So it's a general problem throughout the NHS in Scotland?
I don't know whether it is a problem throughout the NHS or concentrated in particular hospitals. The work that is going on to validate the data will tell me that, as well as telling me of that 980, how many do we believe contracted the virus in hospital, and how many didn't. Of course,
but there's a serious practical problem here, isn't there? Because, look, people watching this who perhaps have underlying conditions, perhaps have cancer, perhaps have delayed treatment, perhaps were looking forward to getting treatment which was delayed, will be absolutely terrified of going anywhere near a Scottish hospital. And it seems extraordinary that you can't say, well, look, there's a particular problem in Hospital X, so we're going to not do extra stuff there until we get it sorted out.
No, Gordon, it's not extraordinary for me to wait for validated and confirmed information before I can definitively answer your question. That is exactly the right thing for me to do. I need to be sure, and the public needs to be sure, that the information I give them is accurate and is validated. The 980 is over the period from the middle of March to the 3rd of June. So that's a long period of activity in hospitals. It is serious, it's important, and it matters, but it needs to be put into perspective, and we need the data validated to know, as I said, how many of that 980 had the virus when they were admitted to hospital but were showing no symptoms, or acquired it in hospital.
There are something like 50,000 care home workers in Scotland. Based on figures produced yesterday, and doing a few sums, which I probably got wrong, my estimation is that almost 15,000 care workers and their families have been tested. Why is that figure so low?
There's two reasons for that. First of all, the priority for the testing that has been undertaken by health boards has been on those care homes which have an active case, testing the residents and the workers in those care homes. And secondly, while some board areas have gone further in their progress of testing care home workers in care homes where there is no case, not all of them have moved as fast enough as I need them to, which is why last week I issued that instruction on the basis that the health service is on an emergency footing. And so from this week, we will publish weekly the data on each board, how many residents have been tested, how many care home workers have been tested.
But this seems to be a problem, and it's not just a problem in Scotland, it's throughout the UK in our response to this. I mean, you announced on May the 18th that all care home workers, whether they had symptoms or not, would be tested weekly. And we're now well into June, and it's not happening. And I'm guessing that if I ask you, can you tell me when it will happen, you won't be able to give me a date.
It's not correct to say it's not happening.
It's not happening in the totality.
What is correct, Gordon, is to say that it is not happening consistently in a planned way across the country, which is precisely why I issued that letter of instruction to every health board chief executive and have said that every week I will publish that information so that you, but I most importantly, and the public even more importantly, can see what is happening and the progress that is being made.
Yes, but what the public want, I suspect, is not data. They just want testing done. And care home workers just want to be tested. Mm-hmm. And it's not happening. Correct. It's not happening in the way that you yourself said it would happen.
Well, of course, one of the reasons that there was difficulty, as you recall, that the unions brought to my attention was because for some care home workers, their terms and conditions, if they were absent, meant that they were only on statutory sick pay. And so people were, as the union said, rightly concerned about being tested, proving positive, and having their income reduced so significantly. I intervened to stop that and make sure that care home workers didn't have that financial penalty. Now, the testing of care home workers is happening, but not as fast as I need it to, which is why I put that requirement on boards. And the data that you're talking about, actually, the public do want that data. They want to know.
No, I wasn't suggesting the public didn't want data. I was suggesting they also wanted action. Now, the policy is of your government that care workers who work for companies which have a chain of care homes or more than one should only work in one care home. Now, on May the 17th, Donald McCaskill, the head of Scottish Care, said on this programme that that policy was not being fully implemented because of staffing problems. Is it now being implemented fully?
Well, it's implemented when care home providers use the portal, where we have a significant number of experienced care home workers waiting to be deployed. And in other areas, we have directly intervened and put NHS staff into those care homes. So there is a mix here between where we put NHS staff into care homes and where care home providers come to us because they know that the staff are there waiting to be deployed into their care home and make that request.
Okay, I'm not sure that's an answer to the question.
It is an answer to the question,
as a matter of
Gordon.
fact, is it now the case that no care home worker is working in more than one care home?
Gordon, I can't give you the answer to that because it is for care home providers. Remember, these are businesses that need to approach and say, we want workers from that care home pool that you have.
Well, okay.
I can't individually, care home by care home, send in staff. I need this to be a cooperative exercise between me and the care home providers.
Well,
I've made the resources available. They need to step forward and use those resources.
Right, there are still, I think, 37% of care homes which have never reported a case of COVID-19. Can you at least give us a guarantee that no care home worker who's working in a home which has coronavirus is then going to a home and working in it where there has been no coronavirus reported?
What I can tell you is that that should not happen, but you've got to remember, I do not control the way care homes operate. Care homes are businesses, either private sector or independent sector, or those run by local authorities. So I need their cooperation in delivering this policy. So to the best of my knowledge, many of them are cooperating, and where we hear of instances where that's not the case, the Care Inspectorate now conducting on-site inspections, then action is taken to address that.
Right, much palaver was made of how Scotland would have the capacity for 15,000 antigen tests every day. The latest figures from Friday show that 3,500 tests were carried out. That's not much more than a fifth of the capacity. Why is that figure so low?
So there's two reasons. First of all, the way in which testing happens. So we test over 70-year-olds who are admitted to hospital. Care home workers and health workers, as well as other public sector workers, and now anyone over the age of 5 who are symptomatic can request a test. But remember that at the moment, the data shows that the level of the virus in Scotland is low, so that will be being requested less. And thirdly, as you and I have just discussed, we need to ensure that there is more consistent testing to implement the national policy.
I understand all that, but again, and you didn't like me using the word extraordinary, but it does seem to me extraordinary. As Jackson Carlaw pointed out last week, if you were doing regular weekly testing of care home workers alone, that would give you 7,000 tests a day. Now, if you add in the even NHS staff regularly testing, that must take you up to, I don't know if it get you to 15,000, but you wouldn't be far off that. So if you were actually testing the cases, the number of people that you say is your policy to test, you'd be pretty much at 15,000. So it's not about lack of demand. If you were doing what you say your policy is to do, you'd certainly be doing an awful lot more than 3,500 a day.
And that is why I issued the instruction last week to NHS boards to implement the policy that I announced and test in those care homes and test care home workers on a regular weekly basis. Now, it is happening in some parts of the country, but not sufficiently across the country. And that is the point of the instruction, to ensure that that happens.
Right. Can I briefly ask you a couple of other things? In England, there's been controversy because they're not counting the number of people testing, they're counting the number of tests. My colleague Tim Harford, on More or Less, the statistician, reckons that it only comes to about 60% of the numbers of people are only about 60% of the number of tests. Now, I suspect there's double counting going on in Scotland as well. Is that the case? Are these figures 3,500? They're not 3,500 people, are they? They're 3,500 tests.
Excuse me. So we make this clear when we make the data available, that sometimes an individual needs more than one test in order to confirm, because if the first test doesn't
do you know, for example, on Friday, how many people were actually tested, or whether the number of people was anywhere close to the 3,500 tests?
Yes, the number of people would be very close to the 3,500 tests, because it is rare for individuals to need more than one test. Okay. But that can happen in the hospital setting.
Very briefly, because we are out of time, but I know this is something a lot of people are worried about, and a lot of doctors are worried about as well. Screening. You're going to start reintroducing procedures into the NHS which have been cancelled. Screening for cancer, there's a lot of worry, obviously amongst the public in general, but also amongst surgeons, that things are being missed. When is screening for different types of cancer going to restart?
Well, our intention is to begin that screening work this month. But again, we need to be careful about making sure that we can do it in a way that is safe for the patients and for the staff. But that work is underway to reintroduce different areas of screening. Remember, we do more than one kind of screening. Yeah. Some of it is relatively straightforward, for example, the bowel screening, but the breast screening does involve close contact. And so in that area, we need to be sure that all the mitigation steps are in place and that staff know and patients know what they need to do. That will mean we will do it more slowly because we will need to, we can't have lots of people sitting in a waiting room, for example, waiting to have their mammogram. So it will take a bit longer, but the intention is to begin that screening programme this month.
All right, Luke, like to go on, but we'll have to finish there, I'm afraid. Jean Freeman, thank you very much indeed.
Thank you.